Welcome, everybody. Welcome, welcome. Come on in. Come on in. It's a beautiful Tuesday, February 4th. My name is Dr. Stavros. Nice to meet you all. If you hear I'm congested, because I am congested. So my apologies if I sound a little congested. I'm a little congested. So it's important to always stay healthy, right? Yes. So I hope you guys had a wonderful weekend. Today is the beginning of a new week and a new month for us, which is very nice. So I'm happy to have you guys on board. Wait a few minutes just to see how everyone is doing here, because it is a brand new session. Now, again, you'll be receiving an email soon in the next couple of days because I've been transferring all my material onto a newer platform. And I assure you it's going to be a lot smoother and nicer because technology changes. And I have all my students and physicians to access everything nice and easy. So I promise you, you all will have access to whatever you have access now. And it'll be a nice, smooth transition. And for some of you, if there's any issues or concerns, please let me know. But it's important to understand that I am here in the Midwest, and these are 2 sessions every week, every Tuesday and Thursday, 8 a.m. Central. Now, I don't know about you, but time zones can be challenging, right? So some of you here are from the East Coast, from the West Coast. Welcome. Others from all over the world. So please, if you can, make sure that you can make these sessions. And if you can't, do not worry. These sessions are recorded for us, for you. Sometimes people can't join because they're working. You're in rotations. So do I want to wake up 8 o'clock in the morning? Well, I'm usually up at 5 every morning, but there's some students here who joined from California. That's actually literally 5 o'clock in the morning, right? So, or 6, one or the other. So the time zones change, right? But for us, if you can make sure you can jump on, we're going to be here every Tuesday, Thursday. Ideally, for all newcomers, there's an orientation video that's usually on our community platform, just to acclimate yourself to AMBOSS and the community. At the end of the day, you're here for one main reason. What are you here for? You're here for me to help you pass your exam. I am not here to teach all of medicine. I can't do that in an hour. We have our QBank videos, which many students are using now, and they help a lot of people. It's basically myself dissecting all the questions I can day by day for your advantage, because content is here, right? You have Kaplan, you have Conrad Fisher, you have, online med ed, you have all these different resources. They're all pretty good, right? But ask yourself, a lot of people go to these sessions and go to these classes, sometimes live versus online, and it's more of a medical review, right? You're reviewing basic sciences, which is awesome. And I know many programs, I'm very friends with many of the physicians, and they do a great job. Many try to work on answering questions for you too. If they can, they do. I myself realized through many, many years of tutoring and mentoring, coaching students and physicians, that the content is there. You read your books, you had your slideshows, everything is usually the same, presented differently. But why do people still fail? Well, the first aid is huge. So that's why I do my best in these live sessions, as well as on our QBank video library, to bring up the first aid, to make sure you can really attack it, because it's about efficiency. It's about learning how to really attack the book, and also QBanks. So, maybe you don't, I love AMBOSS, not because I'm specially a relationship with them. It's because of results. I also love UWorld. UWorld for me is for later. If you started to study now, I can promise you everything I teach you here, you can use any QBank, AMBOSS, UWorld, Kaplan, whatever your heart desires.